Thanks for staying with us. So many times on the show, we've talked about cardiac arrest, its causes and symptoms. Report has it that 3 out of every 10 Nigerian gets cardiovascular disease. So today, our guest will be enlightening us on the possible ways cardiac arrest can be prevented and managed. Joining us on the show is the founder, Prudent Heart Care Foundation, and instructor, American Heart Association, Mr. Jude Onwugbarumuku. Welcome to the show, sir.
Yeah, thank you so much.
You can give us your view or your questions on 070-80668014. You can also tweet to us at TVC Connect. Please hashtag your view TVC so we can read the tweets. So earlier in the day, we were talking about a young man playing basketball and he's slumped. Yeah. And we're worried that young people seem to be having cardiac arrest these days. Yeah. Why is that so, do you think?
Well, it's not just even the story of the basketballer who slumped. We've had cases of footballers. Patrick Ekeng, I think he slumped sometime last year, the South African guy. And a whole lot of them. We had another politician that slumped while jogging last year. Yeah. So the thing is, most of the time, we don't take care of ourselves. Okay. It could be our lifestyle.
Sedentary lifestyle.
Sedentary lifestyle. Many people don't even do exercise. When you tell them, they say, no, I don't have to. I don't want to exhaust myself. So oftentimes it is our lifestyle that actually affects this.
We see people who are physically fit. The footballer is said he's fit. The basketball, they are fit. These are people who exercise every day. So they also fall and slump. So why are you not forcing people like us to go and exercise?
There was one woman that was exercising. She was slim. It's inside the aerobics distance that she
exactly. So obviously that hasn't helped anyway.
Exercise is not just the only factor. It's just one of the factors. Okay. What about smoking? Now you see our youth these days, they even indulge in smoking shisha. Yeah. Shisha is even worse than the cigarette.
Smoking cigarette.
Yes. Yeah. So when one takes shisha, for instance, the person takes about 50 to 120 puffs. Right. That tells us about 1,000 mils of the smoke, as against what you have with a stick of cigarette, about 20 mils.
Okay. So, one of the reasons why we're discussing this today is because people don't seem to know what to do when somebody gets a cardiac arrest. We need to understand the first aid so that people understand that when somebody slumps next to you, you know exactly what to do to save that person's life. Could you walk us through? Yes, YK?
Yeah, because from what I have heard, cardiac arrest, everybody's death is caused by cardiac arrest. Sure. It can be cancer that will kill you, but it's cardiac arrest that is the primary cause. True. So there are some cardiac arrests that you cannot undo because the real cause of the, like, let's say it's
the premorbid condition,
if it's pneumonia, so there's nothing you can really do for that kind of
There are some cases that you can actually save the lives.
You can. You have a whole lot.
Cases, if someone has pneumonia, for instance, and they get cardiac arrest, is it possible to save that person?
Okay, now the question is, we have a whole lot to do even in hospital, because most of the time we emphasize out of hospital. Okay. Most of the cardiac arrests that even happen out of the hospital, and that's the reason why we go out to the communities to train. Okay. We train people even in schools, we train them in churches, mosques, in the malls. We even encourage malls to have AEDs, automated external defibrillators. Now, there is no condition at all that cannot actually cause cardiac arrest. Okay. If you ask a dermatologist, and then, let's say somebody has ringworm, if ringworm is capable of causing death, it will first take the person into a cardiac arrest before death, like what you've just said. Right. So there is no condition, aside from road traffic accident that just happens and the person dies on the spot. Right. So that's the reason why the prevention can be done pre-hospital and in hospital. Okay. The pre-hospital prevention is by training people on the requisite skills to, of course, you know what happens when somebody slumps over. Yeah. They bring out their phones and take selfies with the victim. Yeah. Instead of using those same hands to push on the chest. Yeah. Now, in hospital, you see, I like to always say this. Most of the hospitals we have the equipment, even in Lagos here. But they even have the personnel. But the problem now is, can we match this personnel with the equipment?
Okay. Requisite skills?
Yes, the requisite skills. You see a patient who is on the bed there with a bystander or a relative. Now, before cardiac arrest occurs, there's what we call the pre-arrest stage. In the pre-arrest stage, the health professionals oftentimes neglect those salient things that actually leads to the cardiac arrest.
Wow.
For instance, when you say cardiac arrest, what do we mean? We mean there is no pulse or not breathing.
Right.
Or there is no pulse and gasping, because gasping is not normal breaths.
Right.
So when you see somebody gasping in the hospital, the relative is calling, nurse, nurse, doctor. That is the time they need to start pushing on the chest.
Right.
Not when the person goes completely out.
Wow.
Do you understand?
You cannot touch patient too. When they are in the, you call nurse. If you touch the patient, nurse call, is you that caused anything happen? They will rush at you.
Okay, but we mistake cardiac arrest with heart attack.
Yeah.
Please differentiate.
Okay. Now, a heart attack is a sudden chest pain that results from cessation of blood supply to a particular vessel of the heart.
Yeah.
Okay.
The heart vessels are very minute. So if there is a blockade in the flow of blood, it gives symptoms like chest discomfort, which a whole lot of us ignore.
Right.
Wow.
Chest discomfort is something that we should take seriously. Whenever somebody has any chest pain, no matter how slight it is, it increases in severity. So that's a heart attack.
Is it chest pain or, you know,
Palpitations.
You know, describe the chest pain, because me sometimes I get chest pain, so I need to know.
Now, the chest pain, how it presents, it comes from the center of the chest, radiates to the left arm, the neck, and even the back.
We don't have that one.
I don't have that one.
We don't have that one.
So it actually increases in severity and intensity.
So is there a first aid for that one, or that's
Yes, there is.
Okay.
So it's the same thing?
Aid. Okay. Yeah, it's actually different. For that person, the person is conscious, talking to you. I have chest pain. I feel lightheaded. Sometimes you notice the person even sweats profusely.
Wow.
But in cardiac arrest, the heart's function has stopped completely.
Wow.
So that's why you need to use your hands to manually pump the blood
Back
to
into
perfuse the brain and other vital organs.
Wow.
And the person is unconscious. But in heart attack, the person is conscious, complaining
Now,
of
give us the
chest pain.
symptoms of cardiac, because when we come back on the break, you show us a demonstration, but give us the symptoms of cardiac arrest. How do you know somebody's about to get into cardiac arrest?
Okay, now the first thing is the person has to give some signs of, he might have been complaining, I'm feeling unwell. And you know, with our health insurance scheme in Nigeria, it has really affected us. We don't go to the hospital. Do you understand?
No checkup.
So that's why Prudent Healthcare Foundation oftentimes go to the communities and also have them screened. We conduct ECGs too, electrocardiography. So when you see the ECG, sometimes you might notice that this person's ECG is not following the normal trend. You might anticipate.
Okay.
You see the monitor on the screen, the monitor is showing you what we call a ventricular fibrillation or a ventricular tachycardia. That is, of course, health professionals, nurses, doctors should be able to identify that on the monitor.
Sorry, for a parent who has kids playing football, when I hear slumps on the basketball court, there's one of Lagos State people, Tinubu, also slumped while playing football. All this would have slumped. What happened exactly?
He wasn't even playing. He had even finished playing. He was now sitting down.
Okay.
What happened? What causes those kind of slumps?
Now, when the heart ceases its function, it could be anything. Like I said earlier on, any condition could actually cause a cardiac arrest. Any.
Including diabetes.
If the person is diabetic, if the person is hypertensive, if the person indulges in taking codeine, like you said, I had, when I was working with the teaching hospital in Delta State, a boy of 18 years who took 400 milligrams of tramadol. He took McDowell's, you know this? Whiskey. And then he combined both. And he came to the hospital. He was even hitting on his chest. He said, doctor, nurse, that he cannot breathe. His heart has stopped. We had to laugh. Your heart has stopped, but you're talking. Do you understand? So the thing is, there are a whole lot of conditions, and even our lifestyle, we don't even eat well.
Okay. All right. Let's go.
Poverty.
Yeah, we did. We saved
Let's
him.
go on a break. When we come back, you show us how, because what's most important for us is to know what to do once somebody slumps. What's the first thing to do? But when I hear slumps on the basketball court, there's one of Lagos State people, Tinubu, also slumped while playing football. All this would have slumped. What happened exactly?
He wasn't even playing. He had even finished playing. He was now sitting down.
Okay.
What happened? What causes those kind of slumps?
Now, when the heart ceases its function, it could be anything. Like I said earlier on, any condition could actually cause a cardiac arrest. Any.
Including
so
diabetes.
if the person is diabetic, if the person is hypertensive, if the person indulges in taking codeine, like you said, I had, when I was working with the teaching hospital in Delta State, a boy of 18 years who took 400 milligrams of tramadol. He took McDowell's, you know this? Whiskey. And then he combined both. And he came to the hospital. He was even hitting on his chest. He said, doctor, nurse, that he cannot breathe. His heart has stopped. We had to laugh. Your heart has stopped, but you're talking. Do you understand? So the thing is, there are a whole lot of conditions, and even our lifestyle, we don't even eat well.
Okay. All right. Let's go for Marty.
Yeah, we did. We saved
Let's
him.
go on a break. When we come back, you show us how, because what's most important for us is to know what to do once somebody slumps. What's the first thing to do? When we come back, we'll continue. Stay with us. We'll be right back.
Stay tuned.